Hello, hello, hello. Listen, if sex has become uncomfortable or even painful, this video is for you. If you're experiencing dryness, irritation, or just feel disconnected from your body, that's not just aging and it's not all in your head. It's hormonal and most importantly, it's treatable. I'm Dr. Sarah from Lush Lifestyle, and today we're talking about one of the most common but least discussed symptoms of perimenopause and menopause: vaginal dryness, painful sex, and low libido. These symptoms affect millions of women because guess what? What does perimenopause and menopause affect? How many women? 100%. Okay. And yet, very few are ever told why this is happening or that there's safe, effective treatments to treat it. Let's talk about what's really going on and what we can do about it. Okay. So, what it causes the vaginal dryness and the pain? Well, as estrogen declines, whether it's in perimenopause or menopause, we even see this in breastfeeding, right? The tissue of the vaginal canal begins to thin and what we call atrophy. It loses moisture, it loses elasticity and blood flow. What do we get as a result? Vaginal dryness, burning, irritation, pain or tearing with sex, recurrent urinary tract infections. That's huge, right? Loss of normal arousal and lubrication, right? This is called gentle urinary syndrome of menopause, and it is extremely common, but most women don't know about it or what to do about it, and we just suffer in silence. So we don't want to suffer in silence because there is treatments, okay? We can treat this and have sex become comfortable again, let you feel you again, right? How do we do this? Vaginal estrogen is a huge, huge, huge one. And there is no woman on this planet that cannot take vaginal estrogen. Okay. Vaginal estrogen can give you the confidence back, it can give you that desire back. Let's be real. If sex hurts, your brain isn't going to crave it, right? So when we talk about low libido and perimenopause and menopause, it is sometimes it is about vaginal dryness. Sometimes it can be about testosterone, but it's mostly multifactorial, right? Because our brain is going to protect us, right? And do what we need to do to protect our body. Vaginal estrogen is one of the most effective and safe treatments for restoring vaginal moisture, tissue thickening and flexibility. It gives that natural lubrication back. It balances the pH in the microbiome, so it's protecting us against those urinary tract infections. And it improves blood flow and sensitivity, giving us those sensations back. Vaginal estrogen comes in creams, tablets, rings. It works locally, meaning that very little goes into your bloodstream. So guess what? For majority of women, especially with a history of cancer, you can take vaginal estrogen, right? Remember, even though I'm a doctor, I'm not your doctor, and you need to talk to your doctor about this, but vaginal estrogen is safe for most women. And then here's the other part. What if it's more than just estrogen, right? What if you're struggling with discomfort and decreased libido and desire? Well, oftentimes we will combine vaginal estrogen with other things, right? If we check your testosterone and it's low, we talk about testosterone therapy. There's other things we can do also to increase sexual desire, like PRF, platelet-rich fibrin. It's called an O shot. Inject it right into the clitoris, kind of restore that tissue again. And there's some lifestyle things we think about, right? Do you really actually desire your partner? Is there issues going on with intimacy? Is there other things that are happening in your life that we can help with decreasing stress and reasons that you may want to? Remember, a decrease in libido is multifactorial. It isn't just about hormones. It can be about stress. It can be about sleep. It can be about body image, relationship dynamics. So decrease in libido is very multifactorial. But one of the biggest things that women in this age group suffer from is that sex doesn't feel good, that we're dry, that it hurts, right? Because if it hurts, we're not doing it, right? We are not doing it. We don't even want to do it. You're not broken, and you don't just have to accept this as a new normal. Okay. The bottom line is this: if you're told that this is just part of getting older, if you've been given lubricant, just use lubricant. Oh my gosh, that drives me crazy. And that is just crazy. Or you feel ashamed, disconnected, and dismissed. I want you to hear this. Please hear this. There are safe, effective options. You deserve pleasure. You deserve comfort. You deserve to feel like yourself again. That is right. That is right. You deserve to feel like yourself again. Like, subscribe, share with your friends. Vaginal estrogen is literally almost for everyone. Again, I'm not your doctor. I'm a doctor. I'm not your doctor. Talk to your doctor about it. Drop an email in the comments and we will give you the script to talk to your doctor about vaginal estrogen and just how safe it is. And listen, ladies, we don't have to suffer in silence. Until next time, stay well.